Okay, this is Dr. Tong again. With me is Fred. Okay, Fred, why don't you tell your story? How you come to see me and what your new problem, which is much worse. Okay, what you came to see me first for?
Well, initially it was for diabetes and the ravages of diabetes, i.e. high blood pressure, neuropathy, numbness in the feet, the limbs and everything, and the eyes, obviously. I suffered diabetic retinopathy, had a number of surgeries here, all of which failed, and now I have limited vision in the left eye.
So how about the right eye then? What did surgery do to your vision?
Well, they did. They were. This was actually the strongest eye, and they were going in to try to keep it from doing what this one did, and they ended up screwing it up after about three laser surgery, 3 scalpel surgeries and 2 laser surgeries. Now I can't use it at all. But this one has limited vision in it, and to some degree it's starting to come back. So that was the initial reason why I came in, and in addition to the fact that, let me say, as a benefit bonus, I had edema in my feet and ankles, really bad, and you got that under control. And
so
then,
the neuropathy is better.
well, the neuropathy, yeah, I don't have the surprise stabbings like the hot needles that would stab me. Surprising, I could be sitting talking like this, and all of a sudden I would go like that because I got this stabbing sensation in my feet somewhere.
How often you got that before you saw me?
Well, that was like every day.
Every day, okay.
Yeah.
So now, do you have that anymore?
No.
No, you don't have that, right? So your neuropathy is definitely better, okay?
Yeah.
I do that by improving circulation. And how about your vision on your left eye?
The left eye was doing really great.
Better than
Yeah, it was actually doing better. I could see color contrast and definition. Not so much depth, but I could see color contrast.
But we improve you from our treatment, okay?
Right.
So the way to improve the vision is not through surgery. So surgery mess it up, and you know scarring and stuff like that actually reduce the circulation. We improve the circulation, and his eyes was actually better. The only trouble is that he's a Medicare patient. He only gets 3 treatments every 2 months, and that the progress is much slower. Okay. So what else? What other pain that will help you in the past? Anything?
I had arthritis in the right hip, right shoulder, and left shoulder. All of which is gone, completely gone.
So arthritis can be cured. So
Yeah.
and how long had it been gone?
The arthritic condition that's probably the last 10 years, and I've tried everything to try to eradicate it, but nothing worked. Over counter, the prescription drugs, nothing really worked. Then when I started taking the NBE, I don't have it anymore.
Okay, how long have you not had it anymore? How long?
Oh, I haven't had arthritic problems for over a year now.
So since you got your treatment. So here's another proof. Okay, arthritis can be cured. In fact, did you notice the arthritic pain better the first time or no? The first treatment, do you remember or no?
So far back now, I can't remember.
Yeah, most people get better the very first treatment. But in any case, okay, now
I don't have it now.
Yeah, you have a much bigger problem. So describe to us.
Well, in addition to prior to this later diagnosis, you stabilized the blood pressure. I had no extreme blood pressure conditions, and I was on 4 medications, and then as a result of your treatments, I ended up on 1 medication. Now I don't take anything for that.
Okay, how high were your blood pressure with 4 medication?
Oh my God. I was averaging 190 to 210 easy.
So using medication to treat high blood pressure is a joke. Okay, so now you don't take any medication. How high is your blood pressure now?
Well, now it's like 110, 130 over 75, 80.
You're not saying this to expect I'm treating you for lunch. You're not expecting to say this so that I treat you for lunch.
Oh, no, this is not a paid endorsement. I wish I could get paid. No, that's just the way it turned
So
out.
what we do is we restore the body's health, and that's why the high blood pressure, the arthritis, the eyes, and the neuropathy all get better.